Hello, everybody. Welcome to today's press conference. My name is JP Tasker from CBC News. I'll be the moderator of today's press conference. Before we begin, I just have to read off a little script here that will help us try to avoid audio-related injuries. To prevent disruptive and potentially harmful audio feedback incidents that can cause injuries, we remind all in-person participants to keep their earpieces away from all microphones at all times. When you are not using your earpiece, please place it face down on the middle of the sticker for this purpose that you will find on the table. Please consult the cards on the table for guidelines to prevent audio feedback incidents. These measures are in place so that we can protect the health and safety of all participants, including the interpreters, and conduct our business without interruption. Thank you all for your cooperation. I'll now turn it over to the ministers for their presentation, and then we'll do questions after.
OK, bonjour. Merci. OK, bonjour. J'ai déposé hier l'avis de motion de voix et moyenne relatif à la loi d'exécution du budget. Cet avis ferait entrer en vigueur de nombreuses mesures clés du budget de cette année qui portent sur l'idée d'assurer l'équité pour chaque génération. Our budget is a plan to build more affordable homes, grow our economy in a way that will create good-paying jobs for Canadians, and keep Canada at the economic forefront, and strengthen Canada's social safety net to help make life cost less. A central pillar of Canada's social safety net is our universal public health care system. And a strong healthcare system is essential to ensuring fairness for every generation. Because no matter your age, your income, or your circumstances, every Canadian deserves to feel secure in the knowledge that they will get the care and the support they need. That's why last year we announced a historic $200 billion 10-year health care plan to reduce backlogs, improve primary care, cut wait times, and deliver the health care that Canadians need and deserve. As part of this plan, a key measure of the Budget Implementation Act is a guarantee that the Canada Health Transfer will increase by at least 5% per year until 2027-28. This will be done through annual top-up payments for provinces and territories that are taking steps to improve the collection and management of health data. Cette année seulement, les provinces et les territoires reçoivent 52,1 milliards de dollars du gouvernement fédéral par l'intermédiaire du transfert canadien en matière de santé. C'est le montant le plus important jamais versé pour ce transfert. C'est l'équivalent d'1 milliard de dollars par semaine, versé chaque semaine aux gouvernements provinciaux et territoriaux pour contribuer au financement des soins de santé offerts aux Canadiennes et aux Canadiens, peu importe où ils vivent. And next year, the federal government will transfer close to $55 billion, and the year after that, $57.5 billion. This is going to make a real difference in the lives of Canadians from coast to coast to coast. This is going to mean shorter wait times for surgeries and in the emergency room. It's going to make it easier to see a doctor or a nurse practitioner so Canadians can get the care they need when and where they need it. Nous agissons dès maintenant. Sinon, ce sont surtout les jeunes qui paieront le coût de notre inaction. Et nous ne les laisserons pas pour compte. C'est pourquoi j'encourage fortement mes collègues parlementaires à adopter la loi d'exécution du budget le plus rapidement possible. Nous savons que certaines personnes, comme le chef du Parti conservateur, ne partagent pas notre vision. Pierre Poilievre has already said that he will vote against this budget. That means he's voting against improving our healthcare system so that Canadians can get the care they need. That means that he is opposed to making contraceptives and diabetes medicine free. It means he's against affordable dental care. In the coming weeks, we will also formally table legislation to deliver tax fairness for Canadians. And the Conservative leader has already said that he opposes making the very wealthiest pay their fair share so that we can make these necessary investments in Canadian healthcare. Because ultimately, he believes that the job of government is to do little, then less, and ultimately as close as possible to nothing at all. Let's be honest about what austerity and shrinking the state would mean for Canadians. It would mean you're on your own. It would mean that when you run into a rough patch, there's no one there to lend you a hand. That's not the Canadian way. We take care of each other. Together, we'll unlock the door to the middle class for more Canadians and renew the promise of our great country. And now I have the great pleasure of handing it over to my friend and colleague, Minister Terry Beech.
Thank you, Chrystia. Bonjour à tous. I am here today to provide an update on our historic dental care plan. But before I start, I've actually brought presents for everybody. Let's pass those down there. I was the Deputy Prime Minister's Parliamentary Secretary for 2 years, and I sit on Treasury Board with my other two members that are here today. And it's a great pleasure to be here on such a good day for dental care for Canadians. I want to start by thanking all Canadians for embracing the phased approach to the rollout of what is the largest public benefit in Canadian history. Over 1.8 million Canadians utilized our interactive voice response system to enroll in the Canadian Dental Care Plan. Today, 1 million of those Canadians have received their benefit card and are eligible to access oral health services. In fact, I'm aware that the first to the dentist under this program, the first visit happened at 7:08 a.m. this morning in Newfoundland, and that a further 1,200 individuals have now visited the dentist as of the most recent information that I have, and that those claims have already been processed. We are now also opening up the next phase of eligibility, which includes seniors over the age of 65. That starts today as well. More than 13,000 individuals have already signed up this morning, meaning that I can share that now 1.9 million Canadians are enrolled in the Canada Dental Care Plan. Starting today, the IVR system, which was built on 2022 tax data, has been replaced by an online application, which uses 2023 tax data. This means that Canadians must complete their 2023 tax returns to qualify going forward. I'd like to thank all Canadians who participated in our customer user experience testing programs to ensure that enrolling is as simple as possible. This was a crucial point to make sure that wait times at call centers remained at historic lows. In fact, we never exceeded a 10-second wait time. And as part of my unofficial mandate to get Canadians out of lines and off of waiting on hold. We've made calls already this morning to individuals who use the new web form, and early reports suggest that the sign-up process is very simple to do. I also want to thank a particular group of public servants from Service Canada who were in the office at 3:30 a.m. this morning, making sure that the switch to a new system went flawlessly. This is not an exception. They've been working evenings and weekends to make this project a success. I want to emphasize that our digital-first approach does not mean digital only. For those who need an extra hand to apply, you will be able to utilize Service Canada through our traditional channels, namely in person or over the phone. I would note that we sent 4.1 million letters inviting seniors over the age of 70 to apply. That letter included an April 30th deadline, which of course was yesterday, and that is no longer available. However, those individuals that have not yet applied, I invite them to apply alongside everyone else at canada.ca/dental instead. Starting in June, we will invite children under the age of 18 to apply, as well as Canadians with a disability tax credit certificate. I'll also take this opportunity to remind parents that they have continued access to the Canada Dental benefit for their kids until June 30th, after which the CDCP will replace it. All other Canadians, namely people of the ages 18 to 64, will be invited to apply starting in 2025. We estimate that up to 9 million Canadians who did not previously have access to oral health services will qualify for this plan. 1 in 4 Canadians report not seeing a dentist due to cost constraints. We know, however, that it is much more costly to not take care of your oral health. This is not just the right thing to do, but is a tremendous cost-saving measure for most families. It is another way that we are making life more affordable for Canadians. I want to commend our colleague, Mark Holland, the Minister of Health, for working with dental associations across the country to roll out this first phase for dental providers. As of this morning, more than 6,500 oral health providers are available, and those numbers are continuing to increase. As of July 8th, patients will be able to go to any provider of their choice, provided that they agree to direct bill Sun Life, the administrator of the Canada Dental Care Plan. This is a transformative moment for the health of all Canadians. This is the largest benefit program to roll out in Canada's history, and it has been set up to be delivered in record time. I'd like to personally thank every dental provider who is actively working to put renewed smiles on the faces of so many of our friends and neighbors. And I thank Canadians once again for their patience and understanding as we roll out this historic program. I'd also like to take this opportunity to both introduce but also thank Minister Duclos, our previous Minister of Health, who worked on this project, and our current Procurement Minister, who has continued working on this project through his work with Sun Life. And I'll now hand the floor over to him. Jean-Yves.
Merci beaucoup, Thierry. Bonjour à tous et à toutes. Nous franchissons en effet aujourd'hui une étape importante du nouveau régime canadien de soins dentaires qui rend et rendra les soins dentaires plus accessibles et plus abordables pour les Canadiennes et les Canadiens. En décembre dernier, nous avons lancé le nouveau régime canadien de soins dentaires. Il s'agit de la plus importante amélioration de notre système de santé publique en 60 ans. Depuis la mi-décembre, plus de 1,8 million d'aînés sont devenus membres du régime avec succès, soit plus de 35 % de la population totale des aînés de 70 ans et plus. Plus du tiers de ces aînés admissibles vivent au Québec. À partir d'aujourd'hui, 1 million de ces aînés pourront maintenant prendre rendez-vous pour recevoir des soins dentaires souvent essentiels, parfois pour la première fois. À 7h08 ce matin, la première réclamation de l'histoire du régime canadien de soins dentaires a été faite à Terre-Neuve. Il s'agit d'un moment historique de notre pays. Plusieurs milliers d'autres Canadiens ont aussi pu recevoir des soins couverts par le régime au cours des dernières heures. Ce sont des aînés qui pourront dorénavant mieux prendre soin de leur santé bucco-dentaire et recevoir des traitements afin de répondre à des besoins dentaires parfois négligés depuis longtemps, comme des prothèses, des examens, des radiographies, des nettoyages ou un plombage. Par ailleurs, ce sont plus de 6 500 fournisseurs de soins bucco-dentaires qui se sont déjà inscrits au régime. En moyenne, ce sont 150 fournisseurs additionnels qui s'inscrivent à chaque jour. Des quelques 5 300 fournisseurs pratiquants au Québec, plus du tiers d'entre eux se sont déjà inscrits pour fournir des soins sous le nouveau régime canadien de soins dentaires. Le régime canadien de soins dentaires va changer la vie d'1 million de Canadiens et de Canadiennes au cours des prochaines semaines et nous entendons continuer ainsi pour des milliers d'autres d'ici la fin de 2025. À compter d'aujourd'hui, les demandes d'adhésion peuvent se faire en ligne pour les personnes de 65 ans et plus en allant sur le site web canada.ca/dentaire. Mais on ne s'arrête pas là. En juin, les personnes vivant avec un handicap et les enfants de moins de 18 ans pourront aussi soumettre une demande d'adhésion afin de leur permettre d'avoir accès aux services de soins bucco-dentaires dont ils ont besoin. Contrairement à Pierre Poilièvre, qui est contre l'accès aux soins dentaires pour les aînés, les Canadiens comprennent l'importance d'être en bonne santé et d'investir dans la santé de tous et de toutes. Et c'est pour ça qu'on se réjouit de la mise en place de ce nouveau régime canadien de soins dentaires. C'est pour ça qu'on a déposé un projet de loi pour la mise en œuvre d'un régime d'assurance médicaments. C'est pour ça que nous nous sommes engagés à investir dans les soins de santé, notamment en garantissant une augmentation de 5 % des transferts en santé aux provinces et aux territoires pour les 5 prochaines années. Unlike Pierre Poilievre, who wants to cut back access to dental care for seniors, Canadians understand the importance of dental and health care for all. And that's why we're putting forward the Canadian Dental Care Plan. That's why we're tabling legislation to help deliver the first phase of pharmacare. And that's why we committed billions of dollars, additional dollars to healthcare, including a guaranteed 5% increase to healthcare transfers to provinces and territories for the next 5 years. As Canadians, we are rightly proud of our public universal healthcare system, and it's a part of what makes us who we are as a country. But for far too long, Canada's universal healthcare system did not include dental care. We are changing that. Proper dental care is an essential piece of health and well-being, and Canadians can be proud of the work that many are putting currently underway, and that will increase access to affordable care for all Canadians, especially for lower income and middle class Canadians. When people are healthy and get the care they need, they can be at their best and can give their best. Thank you, and I will now be pleased and proud to share the floor with Seamus.
Merci Jean-Yves. Aujourd'hui est un grand jour. Les premières années qui ont souscrit un régime canadien de soins dentaires peuvent maintenant se rendre chez le dentiste. So if you're between the ages of 65 and 69, you can start your online application right now. And persons with disabilities and kids under the age of 18 can apply next month at canada.ca//dental. But if your Sun Life welcome package has a May start date, you can go to the dentist today. So you can get that toothache treated, you can get new dentures, you can have those cavities filled, no more living with pain. Over 6,500 oral health providers are ready to give you the care that you need today. So ask your dentist if they're participating. Sun Life even has an easy-to-use website to find a dentist in your community if you don't have one yet, or you can just call Sun Life at 1-888-888-8110. The program is scaling up as more people join the plan, and starting in July, you'll be able to visit any oral health care provider. They'll be direct billing Sun Life, so you won't have to pay the full cost up front. And there's no pre-authorization required for emergency procedures. Just be sure to ask about any co-payments or additional fees. But don't take our word for it. Follow the fine and good example of that Newfoundlander at 7:08 this morning. Ask questions, make the call, sign up, get yourself into a dentist's chair, get the care that you deserve. Merci beaucoup.
Okay, thank you, ministers. We'll now turn to the question and answer portion of our event here today, and we'll start with Laura Osmond from the Canadian Press, please. One question and a follow-up.
Afternoon, ministers. I appreciate that the way that dentists can bill for this is going to be changing in July, but in the meantime, are you able to provide a breakdown of the number of dentists versus hygienists versus denturists that have signed up to be part of the program?
Thank you for the question. I don't have that particular breakdown. We can certainly get it to you. As of today, there are 6,500 health professionals that have signed up. That number continues to increase. We expect, now that the Minister of Health has put aside a lot of the issues that were initially raised when we were starting out with this program, that we will see those numbers continue to rise. But let me take a note and get back to you on the exact breakdown of the hygienists and dentists and denturists and everyone else that qualifies under that regime.
Thank you. Minister Duclos, you were obviously involved in the very early talks with dental and hygienist associations and other dental care providers. You got right into the weeds. Some of them are raising some issues with gaps they see that are creating an administrative burden for their offices. They're raising concerns about whether they want to be part of this program or not as a result. What do you make of their concerns based on what you heard from them in the initial stages of putting this program together?
Well, thank you. And I'll start with what we heard from them from the beginning and with what many have been hearing from them for a long time. They've been, in fact, they are the reason for which we are putting that plan into place. They've been advocating for years and decades for the importance of putting dental care in healthcare. So their advocacy has worked. And because of their support over the last 2 years, we are able to put that into place. So it's thanks to them and to the efforts that they have put into not only caring for lots of people over the years, but also for pointing to the fact that too many Canadians don't go and visit a dentist. And when they do so, it's often too late and a lot more costly and painful to look after their needs. And otherwise, they end up in emergency departments under emergency surgeries, and that is a lot more costly for everyone. So they are the true advocates of this plan, and we want to, again, thank them and acknowledge their contribution. This being said, this is a change, a major change in how they will be able to support their patients over the next few months and years. Some of them, as we would be, are asking questions. How is that going to work? How will I greet my first patient with his or her membership card? So we understand that. Fortunately, the Minister of Health, the current one, has done a large amount of outreach over the last few months and especially over the last few years. All of their concerns have been addressed. One concern that they had was whether they had to become member of the plan overall from the start. And many of them, as you noted, have already been registered to become full members of full providers under the plan. But some have said, well, we'd like to try it once or maybe twice, and then if it works well, and we believe it worked well, then we will register as full providers under the plan. And that's what we expect that to see between now and the 8th of July. But as Minister Beech has said, we're already at over 6,500 providers registered. 150 more on average are registering every day, which is a considerable number. And we look forward to even better news over the next few weeks.
Thank you, Minister. Olivia Stefanovich, CBC News.
Good afternoon. My questions are for the Deputy Prime Minister. I'm looking for an update on TMX. What's the plan to sell, and do you have a timeline?
Thank you for the question. This is a significant month because the project is finished and Canada will be benefiting economically. When the Prime Minister took on this project, he did it because he recognized it was in the national interest, that this was about Canada no longer just giving money away for free to the United States. And this was about our national economic security. We are seeing how true that is this month. The Bank of Canada has forecast that the project will increase Canadian GDP by more than 0.2%. For a single project to do that is remarkable, and it comes at a time when we definitely need economic growth and we need our economy to be more productive. From our perspective, the important thing has been to finish the project. The important thing now has been for the project to be operational, and we have been clear from the outset that we will dispose of it in due course. And I do want to take a moment to recognize the really, really hard work of all of the engineers, of all of the skilled tradespeople who got this project built. It was really a challenging project, and they did it. And I also want to point out to people that what we are seeing is Canada as a country is able to get big projects done. This is a project that was only possible because the federal government was prepared to play the leading role. To get big things done in this country, sometimes the federal government needs to lead the way, and we are seeing that here.
Thank you. Does the government have to recover the full cost of the pipeline's development, or is getting it up and ready enough?
The Prime Minister took on this project because he recognized it was in the national interest. He recognized that it was just a bad deal for Canada to be leaving money on the table and sending that money directly to the United States. The completion of this project and the impact which the Bank of Canada is seeing, really significant impact on our GDP, shows that that was the right decision and that this project is tremendously to the benefit of the Canadian economy. And I just want to point out why that is so important, why that contribution to economic growth, why that contribution to Canadian productivity, which we will be seeing in the numbers for the coming weeks and months, is so important. When we tabled our budget on April 16th, we said that this was a budget for fairness for every generation. We said that this was a budget that recognized that particularly for millennials and Gen Z, we needed to do more. That the promise of Canada, that promise of a middle-class life, was not within reach. That people could work hard, they could study hard, they could get a job, but it was too hard to have the kind of middle-class life their parents have. And so we made major investments in housing in the budget. Major investments in affordability. That's what my colleagues here are talking about. These cost a lot of money. And major investments in Canada's long-term growth and productivity. We need to do that because we need a strong and growing economy so that young Canadians can have great jobs and great lives, and so that the government has the capacity to invest in Canada, in our productivity, and first and foremost in millennials and Gen Z. That is, this project is giving us as a country more capacity to do that, and that's really important.
Thank you, Minister. Greg Quinn, Market News International, please.
Mr. Freeland, some economists are saying that the U.S. Central Bank, the Federal Reserve, may not be able to cut interest rates at all this year because of what's going on there, and that in turn could end up hamstringing the Bank of Canada. Do you have any concerns that interest rates may not come down in Canada and that could grind down the economy?
Well, thank you for the question, Greg, but it is certainly not my job to decide what the interest rate should be in the United States, and that's really a question for the Fed. I think the question that you ask has been posed to the Governor of the Bank of Canada, and he's offered a very clear answer to it. I do welcome your question because one of the things our budget recognizes is how important it is to make these essential investments in Canada and Canadians. Investments in housing, which we have made in the budget. Investments in affordability, my wonderful colleagues here are talking about how they are delivering. Investments in productivity and growth, like the $5 billion that we're investing in universities, postdocs, students. These are really essential. They're essential for all of us. They're especially essential to millennials and Gen Z. We recognize, though, that even as we had to make these investments, it was really important to do it in a fiscally responsible way. It was important to meet the 3 guideposts that we set out in the fall economic statement. After the fall economic statement, the Governor of the Bank of Canada said those guideposts were helpful. I recognized that we needed to continue to be helpful to the Bank of Canada because we recognize the importance of keeping inflation down so that the Bank of Canada is in a position where it can lower rates. You have pointed to the fact that Canada exists in a global context. Of course, that is true. Our government is doing our part by sticking to a responsible fiscal plan. And that's important. And the way that we're doing it is by asking those who are doing the best in our country to contribute a little bit more so that we can make these essential investments in Canada and in Canadians.
Secondly, I'm not sure who might wish to answer this, but why is there a mismatch between the economic sales job you're giving the political polls and the numbers that the Canadian economy has been putting in? Why aren't Canadians happier, if you read public opinion polls, why aren't they happier about the economy? Why aren't they happier in your management of the economy?
Shot, and my colleagues, I see some of them champing at the bit here, so maybe they want to add something too. And I'm going to say three things. First, we recognize that things are challenging today for many Canadians across the country. You alluded in your first question to some of the international challenges that put pressure on people in Canada. Putin's invasion, illegal invasion of Ukraine. We are still living with the aftershocks of a once-in-a-generation pandemic. This is a challenging time, and it's challenging for a lot of Canadians. Our government recognizes that, and our budget recognizes that. We recognize that particularly for millennials and Gen Z, right now, life feels unfair. And that's why in our budget, we are making really significant investments in housing, in affordability, in the economy, to make that promise of a middle-class life real for young Canadians. But we recognize why people feel things are challenging. What I will also say, though, is, I think Terry, in kind of a humble brag, hinted to the fact that he was up at 3 o'clock this morning with his hardworking public servants, being sure dental care is delivered. And thank you for doing that, Terry. I think all of us are here because we are committed to Canada and Canadians. And that might sound painfully earnest, maybe painfully Canadianly earnest, but it's really true for me. And so, when we worked on the budget, what we thought about is what are the challenges that Canadians face right now? What can we do as a government to support Canadians in this budget? And we've put forward a plan to address them. That's what I focus on every day.
I'll add, or maybe reinforce something you said. I don't think we're over COVID. I don't think any of us are over COVID. I don't think psychologically we're over it. We were taught to be afraid of one another. We were isolating ourselves. People went through very traumatic events. And we did this as a country, and we did it as a world. When we come out of it, we're confronted with inflation. We're confronted with interest rates. People just haven't had a break. And that's not unusual, unfortunately, for Canada. I think, you could see it in the United States and Western European democracies as well. And you put on top of it an illegal invasion of Ukraine. You put on top of it Gaza and just, general unrest. But, we psychologically, we're not over it. And I think that we don't talk about it. We just all carry on and do our jobs and do our best and try and keep everything together, whether it's a government or a country or our families or whatever. But people, Newfoundland we have a saying, the nerves are rub raw. Our nerves are rub raw. And what do you do other than just do your best and try and recognize where you could be helpful, be ambitious, be helpful? And I think that's, where we are. But, I think talking about it helps because, it gets it out there. And we're not going to understand this perpetual angst that we all find ourselves in if we don't just talk about that.
I spent a lot of time talking as Parlsec to the finance minister, talking about the impacts of global inflation. And this conversation that we're having in Canada is not unique. Half of the world's democracies are going to the polls this year, and they're having the same conversations. We've seen a K-shaped recovery where individuals with assets have done tremendously well. if we think of the context of the Canadian, which is the Canadian context, and the kind of the economic baseline that we rest upon and that we tell people, whether that's the lowest net debt to GDP ratio in the G7 or the lowest deficit in the G7, it doesn't mean much to an average person if your country's economy is doing comparatively well to other economies if you feel like your personal situation is not improving. We have taken the position that we should take Canada's a strong macroeconomic foundation and use it to address the affordability challenges that Canadians are feeling. We think that people are better off with dental care. We think that people are better off and life is more affordable with pharmacare, with child care, with increasing seniors' pensions, etc. There is a false debate that is occurring where the leader of the opposition is trying to argue that these measures are in fact the cause of inflation. We know that is not the case. We've had 3 months straight where inflation has been within the 1% to 3% band. This is certainly, in my estimate, the best policy going forward, and we're fortunate to be in the position where we can not only have those economic fundamentals, but afford to roll out these kinds of programs that are helping with affordability today.
Okay.
On a more hopeful note, because I feel like I ended it a bit of a downer. The good news is that we came out of a pandemic better than just about any other country in the world. Like, we did that, you know, each of us socially isolating and all those things that we went through that were part of the vernacular for so long, and we've just kind of dropped them all. But we did do that, right? And so it makes you feel ambitious about taking on other things. You know, it could be dental, it could be climate change, it could be, you know, trying to figure out our economy and making it fair for everybody and growing it and growing it and growing it. So there's hope on that side. I mean, we should take hope in the fact that we did deal with it as well as we did, as hard as it was.
Davis Legree, iPolitics, please.
Thanks, JP. Thanks, ministers, for taking our questions. I wanted to go back to the Trans Mountain Pipeline. Minister Freeland, you said the government would like to dispose of the pipeline in due course, but I was wondering what exactly that means. Are you looking for a buyer immediately? Are you holding off for now? Can you just walk me through what the next steps look like?
Thanks for the question. Our approach is going to be to take this step by step. This month is a really important milestone that the project is completed. It's now important to have the project be in operation. The key point for Canadians right now is a direct, immediate, and very substantial benefit is coming to the Canadian economy this month. Significant enough that the Bank of Canada actually noted it in its monetary policy report. That is a big deal. I actually can't think of another single project where we have seen a direct, significant level of direct increase in GDP and productivity be attributed to it. That is coming to us right now. And as to, the specifics of your question, we're going to take it step by step. We're going to be very thoughtful and careful and deliberate.
I also wanted to ask if you have any regrets or if you're satisfied with how the Trans Mountain kind of saga played out, I guess. You said the Prime Minister took it on because it was a bad deal to leave money on the table for Canadians, but environmentalists might say that's a bad deal for the planet to dramatically increase our exports of crude oil. How would you respond to their concerns?
I am absolutely confident that the Prime Minister made the right decision. And the completion of the project this month is a clear vindication of that decision. It was a brave decision for the Prime Minister to make. I think it's important also to recognize that it was and is paired with the most ambitious action on climate of any federal government in Canadian history. I think all of us as Canadians can and should be proud of that. But I will point out that there is no reason for us as a country to be giving money away free to the United States. You have been hearing from my colleagues the great things that Canadians need us to invest in. An increase of 0.25, some economists are estimating it's going to be 0.4% of GDP. That means real things in the lives of Canadians, and that is a really, really good thing. And there's just, it doesn't make sense for our country to just hand that benefit to our neighbors to the south. Much as we enjoy being their neighbors and have a great relationship with them, I'd rather us have the money to invest in Canada and Canadians.
Okay, thank you. There is one journalist joining us on Zoom from Reuters. Did you want to ask a question? If so, just raise your hand. Use the raise hand function right now. Please. No, okay. That's it. That's all the questions we have. Thank you so much to the ministers for your
Okay,
time.
thanks everyone for being here.